Good morning to you, to all those who make possible this broadcast, to Gisela who accompanies us from the studio, and everybody who is tuned in. Another good day, another day with favorable results. We had no fatalities yesterday, something that is very important from the evolution of the pandemic, and we have the same number of confirmed cases we had yesterday. We had three cases. In no way this means that the situation is fully under control or that we have overcome the risks. We are making progress and we are moving forward with good prospects. And tomorrow we're going to bring the curves to show you. Cuba has today 240 patients admitted in our hospitals, 10 in surveillance, 115 are suspects, and 115 are confirmed cases. These are the number of active cases we have this morning. In our primary healthcare system, as we always explain, our professionals and specialists are following 327 people with certain clinical or epidemiological risks. Yesterday, the island's different molecular biology laboratories studied 2,069 samples and three tested positive. And that is 0.15%. In the Pedro Curie Tropical Medicine Institute laboratory, 863 samples. In Havana's Provincial Center, 468. In Santiago de Cuba's laboratory, 281. In Villa Clara's, 170 samples. And the brother Amiheira's hospital laboratory, 287 samples processed yesterday. To answer the obvious questions and to clarify what I have been saying over the last few days, samples from all the territories were studied, from all provinces, notwithstanding they are in phase 1. 1,513 samples from Havana were tested. This was the largest number, but again, all provinces had samples analyzed. The most significant, Camagüey with 61, Holguín with 63, Santiago de Cuba 89, Guantánamo with 54, and so forth. All provinces processed samples looking for infected cases. Cumulatively, Cuba has studied 153,233 samples, and 2,315 people have tested positive for COVID-19. This represents 1.5% of all processed samples. Of the three cases confirmed yesterday, all are Cuban. 100% of the cases are confirmed case contacts, and they already accumulate 2,013 people. 88.7% of all cases confirmed in Cuba have been confirmed case contacts previously. In 99 cases, the source of infection is being sought for, and 161 cases, that is 7.1%, the number of people in our country who have been diagnosed with the disease, who have contracted the disease abroad. One of the diagnosed cases yesterday is female and two males, for a cumulative of 1,148 female cases, 49.6%. And 1,167, that's 50.4%, are male. Notice how the behavior of the pandemic here in Cuba is different from other countries where male sex positive cases prevail. And here it's slightly higher, and both sexes have almost similar numbers in terms of confirmed cases. The three cases were asymptomatic, and the number of these cases is on the rise for a cumulative of 1,253 people confirmed during all the epidemic in Cuba, who at the moment of testing positive showed no symptoms of the disease for 54.1%. But if we take a look at how this indicator is performing in the last 15 days, this percentage is increasing. It has increased to 82.2% of all cases diagnosed in the cases in the last 15 days have been asymptomatic at the moment of the testing. This is logical. This is a result of the screenings and population studies. It is difficult at this time to have suspected cases that have not been admitted, and we are covering populations that have not had symptoms or who have been not exposed to any of the risks, and this is in here where we are finding some positive cases that we are reporting here every day. Two of the cases diagnosed yesterday are in the 20 to 39 years of age group, and one in the group of 40 to 59 years of age. No children were diagnosed yesterday with COVID-19, and there is no change to the number of 249 children who have tested positive in Cuba, and 231 have been discharged. That is 92.8%, and as we always ratify, all have a favorable evolution, and they have evolved without complication. All three diagnosed cases belong to Havana, distributed in 3 municipalities, and Havana remains at the top with the highest incidence rate of confirmed cases every 100,000 inhabitants over the last 15 days in the country. But nonetheless, it is lower than the one that it had yesterday. It is currently of 5.43% per 100,000 inhabitants in the last 15 days. It's still diagnosing cases, but it's lower. The rate is lower than yesterday's. Matanzas keeps a similar rate of 0.28%, which is the other province which has reported cases in the last 15 days, 2 cases. The remaining provinces and the Isle of Youth Special Municipality, as we have been saying, they continue without confirming new cases in the last 15 days. These provinces are already in phase 1 of stage 1. In the implementation of this phase has received ample coverage, and the process of transition from one pre-epidemic stage to phase 1 of the post-COVID stage is going on smoothly, and as we have seen in the various media